I'm Barry Aycock, and I'm your host of Business Spotlight. Welcome to another Business Spotlight. My guest today is Sarah Ezel of SEMO Health Network. Sarah?
Hello.
Good to see you again.
You too.
Sarah and I kind of met about a year ago. You kind of come aboard with us as a premium sponsor, and thanks to Sarah and SEMO Health Network, we get to carry a lot of sports on A Corp Media Network, so thank you for that.
You're very welcome.
And I know your favorite team's New Madrid, but you like all the teams, and it was a good year to be a New Madrid County Central fan.
It was, it really was. You know, my husband is from Portageville, so we have a little, some stuff going on in our house, but yes, we are true New Madrid fans.
There's a rivalry even in the house.
Yes.
Well, Sarah, you mentioned your husband. Tell us a little bit about yourself, your family, where you're from.
Okay, so I am from New Madrid, Missouri. Married to the Portagevillian, made him move to New Madrid, and he's doing well for the last 13 years. We have two children, a 6-year-old and a 5-year-old, so you can only imagine our house stays busy. And currently also I work at SEMO Health Network, graduated from Southeast Missouri State back in almost 20 years ago now, and moved back home to New Madrid. That's where family is, and I was able to have a job there, and it worked out great for my growing family, and we're proud to say we're there to stay for the most part.
Good deal. Tell us a little bit about SEMO Health Network.
So SEMO Health Network is a federally qualified health center that's located throughout Southeast Missouri. So we have clinics in 6 counties. The counties include Dunklin, Pemiscot, Stoddard, Mississippi, New Madrid, and Scott County. So we're all over the place. We provide medical, primary care, we provide dental care, and also behavioral health, which is obviously a big thing in the United States at this point in time. One thing we have added is we have OB care in Kennett, and that's a big thing, especially considering that they no longer have a hospital.
Well, Sarah, SEMO Health Network is part of many communities. So what communities do you have offices?
So we do have offices in, let's get started. It's going to be a minute. We have Kennett, Crothersville, Bernie, East Prairie, New Madrid, Sykeston, and Benton.
I called it offices, but it's really clinics, right?
Clinics, yes.
Let me rephrase that. So you have clinics, you're part of the community. I see y'all having these special events all the time, so you truly are part of each community. But what kind of services do they offer? Is each town, you just mentioned OBGYN, does each town have its own kind of specialty? Each
town does primarily have a specialty. Most of our clinics do house medical. We do have dental facilities. The dental facilities are only right now in Bernie, Sykeston, and East Prairie. Oh, sorry, take that back. Also, Crothersville. We do hope to get a new dentist in Kennett soon to reopen the Kennett facility. Obviously, there in Kennett, we do have OB with the behavioral health. One thing that is new to the communities is our school-based health center, which is a huge, huge thing for schools in general, and we have one at the Sykeston School District right now. Hopefully, we'll have more soon.
Well, it seems like it's a fun place to work, and it also seems like the community really supports SEMO Health Network, because I'll be passing through Sykeston or Bernie, and it seems like ever so often you're having some type of special event. So what type of outreach do you do in these communities?
We are full of outreach. Anything from us attending health fairs, our partnership health fairs. If a community partner says, hey, we're having a small get-together health fair, we normally try to represent SEMO Health Network. We create our own type of health fair. I know this summer we hosted our Spring into Healthcare summer event. We housed a, so to say, health fair, more of a community event, like I said, at each of our locations. We provided meals, we provided other vendors to come in, set up booths, share their resources and information, because that's big to us. The reason that we do attend health fairs and do attend outreach events is because we want to share resources throughout the community of Southeast Missouri. It's big for us, especially for our patients. Sometimes our patients who may be in need, they don't know where to go, and so it's really good for us to house those partnerships locally and know where to send our patients.
I noticed there's food involved in a lot of these outreaches, so that's a big draw for the community
Yes,
also.
you know, if food's involved, you have a big draw. All you have to say to me is food will be there, and I'm normally there.
So give me a sense of a patient that comes to SEMO Health Network. Are they low income, high income? Do you serve everybody?
I am very glad you asked that question because one thing that I like to, when I present or give a presentation or just talk to a local business, they ask that question a lot. And I think a lot of people think that SEMO Health Network is only for low income patients or patients that may be just on Medicaid or need our sliding scale discount fee, but it is absolutely not. We see all insurances, we do see Medicaid and Medicare, and then what we like to do is tell people, like, yes, we see it all, but if you fall into a category where you do not have insurance and you do not have the adequate income to pay for your medical care, we do have the option for you to apply for our discount program, which is the sliding fee. And then we can let you know what your cost will be significantly lower than what it would be if you were just paying straight out of pocket. So, like I said, very glad you asked that question because a lot of people do think we're only for low income, and that's definitely not the case.
I know Bernie has dental, right?
Yes.
And they're covered up all the time.
Covered up.
I pass the Bernie branch twice a day coming and going to the studio here, and people come from all over to come to the Bernie for dental work, correct?
All over, yes, for dental. And we also have medical at Bernie. Bernie has medical and dental. Yes, dental is a big deal right now in Southeast Missouri and really throughout the United States. You'd be surprised there aren't many dentists ready to move to Southeast Missouri or really throughout the nation right now. There's not a lot of dentists around. So we, along with others, are struggling to find the dental care that we need, and that means having enough dentists in our facilities. Right now, we could probably hire 5 dentists,
Wow.
And we'd be good to go because we do have a waiting list, even for the kiddos, just to get a cleaning. And that's a big deal, especially at a young age. They need to get in and be seen, and it's hard to provide adequate care when we're struggling to, have a dentist.
Well, Sarah, part of your role is marketing SEMO Health Network, but I see some of your pictures on LinkedIn, and it looks like you do a lot of free lobbying for your company that you work for. So do you bring those up to our elected officials about the scarcity of dentists, rural doctors, and things like that? Do you bring that up to our elected officials?
Absolutely. I was just in Washington, D.C. a few months ago, and that was one of my top topics that I brought to the table. We need that in Southeast Missouri, and we need to have, not only was I talking about needing dentists, but along with needing dentists is we need, our economy to be different. We need jobs. We need a lot involved. We need our dentists to see something that they want to come somewhere where they want to come and live. So yes, absolutely. We yearly, I'm in Jefferson City. Luckily I was in DC this year, but yes, we are constantly advocating for ourselves and our communities and letting those people know what is needed in our area.
Sarah, is rural healthcare in a crisis right now, or is that overstated in the area?
I wouldn't say on my level with SEMO Health Network is who I'm talking. I'm not going to say crisis, but I will say we need providers. Yes, our biggest issue right now in healthcare as a whole is we need the nurses, we need providers. After the pandemic, people are, so to say, they're out, they're done. And I get it. They went through hard times. We all went through hard times. So we need nursing staff. We need the providers. So crisis, yes, on the verge. For us, we see new things daily. We lose a nurse, we gain a nurse. We lose a nurse, we gain a nurse. So we're still, doors are open, and we'll do all we can to continue that. And thankfully, with the help of the federal government, that happens with us. But yes, it's, I would say, on the verge. Yeah.
So many times our elected officials, they know what the problem is, but they don't really ever have a solution. We don't either. So do you have any solutions to some of our healthcare rural crisis?
I think with us, and I kind of go back to that, needing the providers in the area. We need more doctors, we need more dentists. I think that, and it goes back to providing jobs in the area, because showing that our schools are top notch and better. And I think that's a big thing for us. For us to recruit a dentist or a doctor into a small rural town where most likely, if they're a brand new provider, they're coming from a university that houses everything, and you can get a Chick-fil-A around the corner, or a Starbucks is at every corner, literally. And we don't have that here. So I think just selling ourselves as small town USA, I know we can push we're right in between Memphis and St. Louis, and we can say that every day, but we don't have the Starbucks. So I think just promoting and proving that we are, yes, you can live cheaper here. Yes, there are things to do. I think that's the biggest thing.
So Sarah, it's exciting times there, a lot of changes, a lot of advancements coming with SEMO Health Network. Tell us about this new mobile unit that y'all put into practice this year.
Yes, so we're really excited to have our own dental mobile unit. It will travel throughout Southeast Missouri. What it is it's like a huge dentist office on wheels. It's got 2 full suites, able to do x-ray on the bus. Our dentist will be able to go in and do full fillings, everything that anyone could need. So what we're starting out doing with the mobile unit is really just focusing on dental screenings for the kiddos in the schools. I'm not sure if a lot of people realize, but there are kids out there that don't see a dentist at all because their parents either can't get them to a dentist, or there aren't dental facilities available in their area. What this unit will do is we'll pull up straight to the school. Parent just has to sign off that the child can be seen. The screenings are happening, and if our dentists see any issues or concerns, they will let the parent know, and then we can get treatment started.
So you're bringing the services straight to the client.
Straight to the client,
Yep.
Yes.
That's
yes.
exciting, and that's really a good thing that SEMO Health Network's doing. So
Yep.
Sarah, was this your idea?
I wish I could say it was, but no, we partnered with Southeast Missouri State for years with the Showmobile for these dental services, and unfortunately that bus just aged out. And we had to retire him. And so once that happened, we noticed that we still needed to see these kids, because when we stopped, also their dental services stopped. So we were able to get our own and apply for some funds, and it worked out, and here we go again.
You saw that Showmobile everywhere.
Everywhere.
Yes, everywhere.
So now you'll see the SEMO Health Network bus everywhere.
Sarah, explain to the audience what a patient-centered medical home is.
Okay, so a patient-centered medical home came about probably the last 12 years or so. What it is that, through our facility, I would say 12 years ago, what it is that we are able to touch base on measures that are needed throughout our health center. With that being said, we are able to provide care, extra care that necessarily other clinics, other primary care facilities may not touch on. For example, we're check marking off that our patients have had mammograms, that they're seeing, they're making sure that their preventative measures are taken care of. There's a group of questions that are asked at almost every single appointment, and sometimes it gets rather annoying, but the reason that we ask those are to make sure that we're providing the quality of care, and because of that, we are able to qualify as a patient-centered medical home, and right now we are at a level 3 at 4 of our facilities.
And your office is in Benton. You're housed at Benton, correct?
Yes, corporate office is at Benton.
Do you get to get out and see some of the success stories at each of the clinics?
Yes, I do have an office in Benton, and I also have an office in New Madrid, but I am anywhere from Kennett to Benton to Bernie all in one day's time.
Well, Sarah, you've worked off and on at SEMO Health Network for years. How has it evolved and changed over the years?
It has evolved so much. So obviously we opened in 1979. That was before my time, but turned into a federally qualified center in 1980. and 84-ish, I think, is when that happened. And so from then on, it just grew and grew. It started out in New Madrid, opened a facility in Kennett, and it just went from there. One of the big things that happened back then is we really took care of the migrant workers down in Kennett, and that was a big thing. So that is still happening today. In addition to that, we started opening our dental centers, and obviously we know that was something that's very needed in rural southeast Missouri. And then today, like I said, we have 13 clinics throughout. We've opened, I mentioned earlier, the school-based health centers, which is one of, it kind of makes me proud. We're starting early, making sure that it's easier for the kiddos to be seen. They're not having to be pulled out of school to go to a doctor. They can be seen right there in the facility, along with the teachers. And that's a really big thing when you think about it. You're not having to take off work to go to a doctor. And I think it really provides quality of care. One big thing that I've seen, and this may be new to you, is that we are in the process of building a brand new medical center in New Madrid.
Wow, I didn't know that.
Yes, so we actually are hoping for a groundbreaking to happen this September. So next month, I should have information on that next week, and we'll go from then. So we're hoping at 10, they're saying 10 months, but you know how buildings are.
It'll be
so
20 then.
It could be 20, you're exactly right.
That's big news. That's exciting times
Yes,
then.
yes, it's a really, really good thing going on in New Madrid.
So since 1979, technology in the medical field's changed drastically, but also your clientele. You talked about the migrant workers, so you've built more clinics since 1979. You're in many different communities, so change has come fairly rapid here in southeast Missouri.
Very rapid, very rapid.
And
yes.
like I said, your clientele's changed, and I'm sure that market of migrant workers has grown over the last
Absolutely.
10 years also.
And it's not just in Kennett either, so I feel like it's everywhere. Yeah.
Well, Sarah, you stole my next question. What does the future hold for SEMO Health Network? You're growing.
Yes.
What does growing look like for SEMO? What's the goals in the future?
I mean, you never know. So we do work on a 5-year strategic plan. The biggest thing is, to maintain and keep what we have while also making it better. The big thing right now is our new facility in New Madrid. We hope to grow Bernie. Bernie is busting at the seams, both medically and with dental. So we're hoping to find some funding. We've been to the state, we've talked, we've said we need this, and Southeast Missouri, rural America needs this. So we hope to expand and be able to serve the communities that we feel needed, and make it where we don't have to put someone on a waiting list. We don't want that. We want them to be seen when it's needed.
Well, I want to give a shout out to your Bernie clinic because I'm by there, like I said, at least twice a day, sometimes 4 times a day. They never get to go home at 5 o'clock.
No, they don't.
I don't know what time they go home, but they don't punch the clock at 5
They
o'clock.
don't. Our dental, actually, they don't leave until 6 o'clock. So we try to have those extended hours because we understand that people do work, and we want to make sure that they have the access to care.
How many employees does SEMO Health Network employ?
As of this week, we have about 162 employees.
And it looks like they all enjoy their job, and especially at these special events.
They do. Oh, they love the special events. We try to utilize all of our employees, pull them out of the clinics, and we take a few hours off for them to be able to network at the events, meet other people, and get information that's for our patients. Our staff loves the events. They get to eat, they get goodies, gives them a little break, makes the day go by. So it's always great to incorporate staff into every aspect of the events.
Well, Sarah, thank you for being here today and sharing the story of SEMO Health Network. I'm going to give you the last word to the viewers about SEMO Health Network.
Okay. So SEMO Health Network, like I said, federally qualified health center throughout southeast Missouri. If you need a primary care provider or a dental provider, or you're struggling with mental health and need a behavioral health consultant, give us a call. We're pretty much located throughout any of the communities in southeast Missouri, and we'll get you fixed up. Thanks for having me.
Sarah, thank you once again. They're partners with us on bringing sports into your house on A-Corp Media TV, and you backed the winner last year, which
That's right. Oh.
you had many winners.
That's right. That's right.
So thanks again for bringing sports to people's households and being a partner with us here at A-Corp Media.
Thank you for having me.
Come back sometime.
Will do.
Thank you.